My therapist is Miss McEwen. She is a speech pathologist. She's been doing this for 22 years. I chose her because I had a speech problem when I was younger, so I would like to see how they work. The interview took place at her house around 4 p.m. The purpose of this interview is to find out more about speech therapy and how it relates to psychology. Why did you become a therapist?
I became a speech therapist. The real reason is because freshman year in college, the professor in one of my first semesters at UF went around the room asking everybody what their major was. And being a freshman new to the university, I was just dreading when it was my turn. He went through each kid, and I was probably 7th or 8th in a class of like 25 kids. And two girls in front of me said, "I'm a speech therapist," and she was adorable. And I was like, "Oh, really?" And so he got to me, and instead of saying undecided, I was like, "Speech therapy." And I really wasn't even sure what it was. And I went home that day back to my dorm, and I researched and asked everybody I knew, and I decided the next semester to take an introduction course in it. And believe it or not, I'm very happy, and it's a very rewarding field, but that is the first time I ever even heard really what a speech therapist was that day.
What's your degree in?
My undergraduate degree is a Bachelor of Arts in Communication Science and Disorders and a minor in audiology, which is hearing science. And my master's degree is a Master's of Science in Speech and Language Pathology. To be a speech pathologist, you must have your master's degree before you're allowed to have your license.
How are you licensed?
So I have my 4-year undergrad degree, like I told you, from the University of Florida, Bachelor of Arts, and in the Communication Sciences Disorders. And then you have to have your master's degree, which is about a 3.5, 4-year full-time program, Master's of Science degree. And I got that at Nova. And then to work, you need a certificate from the Department of Health. So you can have your state of Florida license. And every 2 years, you need 30 hours of continuing courses for the rest of your life that you want to be licensed by the state. So they're called continuing ed requirements, and that's 30 hours every 2 years. So I have the state of Florida license, and I also am licensed with the American Speech and Hearing Association. That's called ASHA. And if you have your specialty in ASHA, you have something called CCC. That's a Certificate of Clinical Competence. So speech pathologists can also, if you're continuing, you also need extra credits each year besides the state of Florida license to keep your Cs, which is your Certificate of Clinical Competence. The evaluation process for a patient, I work in the adult field right now, so some speech pathologists work with children and some work with adults. And when you're in college and you're in your master's portion of your degree, at the very end, when you're done with classwork, they send you on externships. You have to do an adult externship in an adult setting, and you have to do a child or pediatric setting. So when I do the adult setting, which I'm working in now, you have to have a prescription from the doctor. And then once I get the prescription, it will say speech and or swallowing. And 75% of my day is dysphagia, which is people difficulty with swallowing. And it's a muscle that most therapists you don't think of all the time. Most of them think of physical therapy with their muscles or occupational therapy with their hands and fine motor. But the majority of my day in the medical field of speech pathology is working with the swallowing muscle, your larynx. And the other part is cognition. So I'll get an order for, let's say someone has dementia or someone has history of a stroke or just had a stroke and their words aren't coming out. That's aphasia. So the diagnosis will be to evaluate the patient, and that's when the patient will come in. We'll set up an appointment, and I'll get a good history of the patient and see what brought them. Usually they're coming straight from the hospital once they're discharged from the hospital. And I'll do a clinical evaluation, and then we'll use standardized testings as well. And then we'll start a treatment plan depending on how they score on their evaluation. I work in a team setting where I'm working with physicians on a daily basis. I also work with social work and home health as well. So when I see the patient, I will meet and read the physician's notes and see usually their history or what has brought them to the rehab facility where I'm working at. And a lot of times I go into the home also to do home health therapy. And it's crucial that you have a really good working relationship with the physicians. I work a lot with the regular primary care doctor. I work a lot with the GI docs, which are the gastroenterologists. A lot of the stomach problems relate to their swallowing. And I work with a lot of geriatric doctors. And a lot of times I'm referring to psych for a psych eval. And a lot of times we'll see people clinically depressed. If you're not eating and drinking okay and you're needing a tube to eat or drink, your quality of life changes. And so the speech pathologist really has to be observant on depression and symptoms of depression. And also our goal is to get patients back to their prior level before their accident or injury. So you need a real good baseline of how the patient was before, because if they weren't doing so great before, you're not really getting them better than they were initially. So you're hoping that their doctor knew them and knows their history, so you're working with their doctors on a regular basis.
I asked Miss McEwen if families play a role. She said yes, all of them do. She gave me the example that if a patient needs to have her food blended and a family does not help, then the patient will never get better. She typically gives goals for both patients and the patient's family. McEwen also told me that during a session, the first one is usually just to get to know the person. And then they have the pre-session and then the post-session, usually before surgery, before getting their vocal cords removed or if they have cancer in their throat and they can't speak after, and then therapy after the surgery so they can mentally help them and physiologically help them. I also asked how payment works. She said their insurance uses it, they only have a small copay. And first they get evaluated each person. Usually insurance lets them do 2 or 3 times a week for a month. If she feels like her patient doesn't get full treatment and help in that month, she has to get asked for a reevaluation from their insurance company to get more months and more sessions. Miss McEwen told me a story that she will never forget about when she was working with little kids. This kid was a 5-year-old boy who had selective mutism, which means he rarely spoke. And she tried to get him to speak, but he never did. He was her favorite patient at the time. She looked forward to go to school to see him and work with him. It later found out that he was being sexually abused and physically abused by his parents, and he wouldn't talk. The last day she saw him, she saw a handprint on him. She told upper authority, and when the parents found out, they switched him to a new school, and this kid had to jump from foster home to foster home, and he still wouldn't talk. And it just amazed me how that could happen to someone, and a speech therapist had to help him out. In this interview, I can conclude that all therapists have very different jobs, but they all help people and try to make someone's life better than it is.